a silent emergency that strikes without warning. Every year, millions of people around the world lose their lives or their independence because of one of the most time-sensitive medical emergencies known to medicine: stroke. It remains one of the leading causes of death globally and the top cause of long-term disability in adults. Yet, despite how common and devastating strokes are, surprisingly few people know exactly what a stroke is, how to recognize it, or what to do in the crucial first minutes. Before we begin, make sure to subscribe and turn on notifications. And tell us in the comments, have you or someone in your family ever experienced a stroke? Your story might help someone else learn. This knowledge gap costs lives. This guide aims to close that gap with clear, accessible, professionally written medical education designed to keep viewers engaged while helping them understand how to act quickly, confidently, and correctly. The purpose is not to frighten anyone, but to empower. Because while stroke is dangerous, modern medicine now offers remarkable treatments that only work if people recognize the warning signs early. In this professional breakdown, we will cover what a stroke truly is in simple but medically accurate terms, why minutes matter and what time is brain means, the two major types of stroke, early warning signs everyone should memorize, the BEFAST tool professionals use worldwide, modern treatments that can reverse a stroke, realistic case examples to illustrate how medical teams respond, what you, as a bystander or family member, must do immediately, how modern medicine has changed outcomes in the last 20 years, steps to protect your brain health long term. This is the kind of information every household should know. It can protect your parents, your partner, your friends, or even you. Let's begin by understanding what a stroke really is. Chapter 1. What actually happens during a stroke? A stroke, also known as a cerebrovascular accident (CVA), occurs when the brain's blood supply is interrupted. The brain needs a continuous flow of oxygen-rich blood to function. When that flow stops, the tissue begins to die within minutes. There are two primary categories of stroke, each with its own mechanism, risks, and treatment options. 1. Ischemic stroke is almost equal to 85% of all strokes. This is a blockage. A clot forms or travels to a blood vessel in the brain and wedges there, preventing oxygenated blood from reaching the tissue beyond the blockage. Without oxygen, brain cells begin to die rapidly. 2. Hemorrhagic stroke is almost equal to 15% of strokes, more deadly. This is a bleed. A weakened vessel ruptures, causing blood to leak into or around the brain. This bleeding increases pressure, compresses delicate tissue, and damages the brain both physically and chemically. Both forms are medical emergencies, but they require different treatments. That is why hospitals rush stroke patients to imaging, specifically CT scans, before anything else. Even though the causes differ, the underlying issue in both is the same. The brain suddenly loses access to the fuel it needs to stay alive. This leads us to a crucial principle in neurology. Chapter 2. Time is brain, why minutes matter. The phrase time is brain is more than a slogan. It is a biological fact. The human brain is only 2% of body weight, but consumes 20% of the body's oxygen supply. When blood flow stops, neurons begin dying within 4 minutes. Every minute after that, an estimated 1.9 million neurons are lost. This is why immediate action is essential. Delays can mean loss of speech, permanent weakness or paralysis, memory impairment, difficulty swallowing, loss of independence, even death. Modern stroke treatments, such as clot-dissolving medication or mechanical clot retrieval, are powerful but only effective within strict time limits. Understanding the early signs is not optional, it is critical. Chapter 3. Early Stroke Recognition, the BEFAST Method. Medical teams across the world use one simple tool to quickly screen for stroke symptoms: BEFAST. Every person should memorize these 6 letters. B. Balance, sudden trouble walking, dizziness, or loss of coordination. This may look like the person is intoxicated, but it is often neurological. E. Eyes, blurred vision, double vision, or sudden vision loss, particularly in one eye. F. Face, one side of the face may droop. The smile may look uneven or crooked. At arm, ask the person to raise both arms. One may drift downward or not lift at all. S. Speech. Speech may become slurred, confused, or entirely absent. T. Time. This is the most important step. Call emergency services immediately. Do not drive yourself unless absolutely unavoidable. Paramedics can begin care en route. The BEFAST system is reliable, fast, and easy to teach. When it becomes second nature, it saves lives. Chapter 4. Understanding the two modern treatments that save the brain. Medical advances in stroke treatment are among the most extraordinary achievements of modern healthcare. Two main interventions can not only stop a stroke, but in some cases reverse the damage. Treatment 1. Intravenous thrombolysis, TPA/alteplase. This is a clot-dissolving drug given through a vein. It travels through the bloodstream, reaches the clot, and breaks it apart, restoring blood flow. However, it only works for ischemic strokes, and it only works if administered within a critical time frame. The 4.5-hour window. TPA can be given up to 4.5 hours after symptoms begin. After that, the risk of bleeding outweighs the benefit. Many patients cannot receive TPA simply because they arrived at the hospital too late. Recognizing symptoms early is the key to making TPA possible. Treatment 2. Mechanical thrombectomy, clot retrieval. This is one of the most transformative procedures in modern medicine. A specialist inserts a catheter through an artery in the groin or wrist, guides it up to the brain, and physically retrieves the clot. A mesh device, called a stent retriever or suction catheter, is used to pull the clot out and reopen the artery. Mechanical thrombectomy can work even when TPA cannot, for example, when the clot is large or when the stroke began many hours earlier. The extended time window. In selected patients with specific imaging findings, thrombectomy can be performed up to 24 hours after symptom onset. This extended window has dramatically changed outcomes for thousands of patients. Chapter 5. Real-life clinical example. Early response saves a life. Let's examine a professional, realistic case illustrating how TPA works when given promptly. Case. A 57-year-old man with sudden weakness. A man in his late 50s is sitting at home when his family notices he suddenly cannot lift his left arm. His speech becomes slurred. His face droops. They immediately recognize the signs and call emergency services. The paramedics arrive within minutes. Upon arriving at the hospital, he receives a rapid CT scan to rule out bleeding. No hemorrhage is present, meaning he is a candidate for thrombolysis. The TPA medication is started through an intravenous line. Over the next half hour, the clot gradually dissolves. He begins regaining movement in his arm. Speech improves. He is monitored closely for several hours. Quick recognition and immediate action prevented permanent disability. Chapter 6. Real-life clinical example. Mechanical thrombectomy and late presentation. Now let's examine what happens when a patient arrives outside the 4.5-hour window. Case. A 71-year-old woman found with morning paralysis. A woman wakes up unable to move one side of her body. Because she was asleep when the stroke occurred, doctors cannot determine the exact time of onset. That generally excludes TPA. At the hospital, imaging reveals a large artery blockage. She is taken to a specialized interventional radiology suite, where a catheter is used to remove the clot. In real time, physicians watch on imaging screens as blood flow is restored to the affected area of the brain. In many cases, patients begin regaining movement almost immediately. Thanks to advancements in mechanical thrombectomy, patients who previously would have faced lifelong disability now have a chance at recovery. Chapter 7. Why acting fast is your responsibility too. Not every stroke patient can call for help. Some lose speech. Others lose consciousness. Many are confused or unaware something is wrong. This is why family members, friends, coworkers, and even strangers must be educated. The first medical decision is often made by you, not a physician. Your willingness to act without hesitation can determine whether someone walks again, speaks again, remembers their family, lives independently, or loses those abilities permanently. You are the first link in the chain of survival. Chapter 8. What to do immediately if you suspect a stroke. Here is the professional approach used by healthcare providers. 1. Call emergency services. Do not wait to see if it improves. Do not let the person sleep it off. Do not drive unless it is the absolute only option. 2. Note the time symptoms started. This is critical for determining eligibility for treatment. 3. Keep the person safe and calm. Do not give food, drink, or medications. Monitor breathing and consciousness. 4. Allow emergency personnel to evaluate. Paramedics can start early testing and communicate with hospitals ahead of arrival. 5. Go to a hospital with stroke capabilities, preferably one with a stroke unit or thrombectomy service. Chapter 9. How modern medicine has transformed stroke outcomes. 20 years ago, stroke care was mostly supportive. Doctors could control blood pressure, prevent complications, and offer rehabilitation, but reversal was rare. Today, rapid intervention can restore blood flow and minimize damage in ways once thought impossible. The combination of thrombolysis and mechanical thrombectomy has reduced disability and mortality dramatically in hospitals that use these methods. However, the effectiveness of these treatments depends entirely on how quickly patients arrive. Public education remains the most powerful tool we have. Chapter 10. Long-term prevention and brain health protection. Reducing the risk of stroke involves controlling the factors that damage blood vessels. These include high blood pressure, high cholesterol, diabetes, smoking, obesity, sedentary lifestyle, irregular heart rhythms such as atrial fibrillation, excessive alcohol intake, regular medical checkups, healthy eating, physical activity, and early treatment of medical conditions all play important roles in prevention. Conclusion: education is your most powerful tool. Stroke does not always give a second chance. It strikes quickly, silently, and without regard for age or lifestyle. Yet modern science has given us remarkable tools to fight back if we act quickly. Remember the principles. Know the signs using BEFAST. Call emergency services immediately. Do not wait. Time is brain. Every person who watches this and learns these steps becomes an essential part of the solution. You can protect your family. You can save a life. Thank you for being willing to learn, understand, and prepare. If you found this information valuable, please like, share, and subscribe. Your support helps us create more life-saving educational content.